COVID hospitalizations are trending down in Dallas County, but flu hospitalizations, well, those are up. Right now, 34 patients are hospitalized with the flu in Dallas County. That information is from the North Central Texas Trauma Regional Advisory Council. Flu activity is also up in Tarrant County, with health officials saying reported flu-like illnesses increased to nearly 5.7%. That's a slight increase from last week, but still enough for officials that is, to continue pushing residents to get flu shots this season. And as we do each Thursday, let's bring in Dr. David Winter from Baylor Scott and White Health to answer your health questions. Good morning, Dr. Winter. Want to get to it. Anything new to report regarding RSV?
Well, RSV is still out there. We're seeing about 7,000 new cases every week in this country. Some hospitals are still full with young kids. It's interesting, it attacks the younger kids, 5 years or less, and even worse, 6 months or less. But in adults and older people, we really can't tell the difference between that and a common cold. So if you have cold symptoms and you get around a baby, they may not tolerate that well. So I'm encouraging people not to get around babies if you have any kind of mild cold symptoms right now, because RSV is still out there filling up the hospital beds, particularly at the children's hospitals.
Very important there. I want to get to a new report that's out saying resting your mind can be as effective as medication for relieving anxiety. Tell us about that study.
Yeah, resting your mind, another word for that is mindfulness. And so mindfulness you can get from listening to classical music, meditation, some forms of yoga, even just sitting quietly and focusing on your breathing. That works. And so in this study, they took folks and had them do mindfulness exercises for 45 minutes every day, then 2.5 hours once a week, and compared that to folks who had anxiety, depression, and took pills. So if you're anxious and depressed and you took pills or you took mindfulness exercises, which was best? They were equal. So either one works. If you're anxious or depressed, you can do mindfulness, you can take pills, or you can do both. Double duty.
I always love a good meditation session for sure. Well, some people use over-the-counter supplements to treat high cholesterol in place of prescription cholesterol-lowering medication. How do these two forms of treatment compare?
Yeah, the Cleveland Clinic just did a study on this, and they gave folks either a handful of supplements that included fish oil, cinnamon, turmeric, garlic, red yeast rice pills, or they gave them the prescription statin drugs and they compared to see how they lowered cholesterol. Well, it wasn't much of a contest. The folks who took the supplements had a very trivial decrease in cholesterol. Folks with statin drugs had a significant decrease. Now, we've known this for a while. These drugs were invented in the 1980s, and since then, strokes and heart attacks in this country have declined because of these. You can also lower cholesterol by diet, exercise, but if you really need to get that cholesterol down, you might want to talk to your doctor about statin drugs, because the supplements, at least in this study, didn't do very much.
We are also seeing more reports of long-lasting COVID symptoms. What is being done to treat this condition?
Yeah, fortunately, most folks who get COVID don't have long COVID that lasts weeks or months, but we're seeing a fair number that still get that. The symptoms mainly are fatigue, muscle aches, trouble concentrating, brain fog, we call that. And we don't really have a good treatment for that, but a new study said that if you take Paxlovid, a prescription drug, early in your COVID infection, that can actually significantly lower your chance of getting long COVID. The same drug, Paxlovid, it also works to prevent serious illness. So like we have something that we can do to prevent still treating long COVID, that's a challenge right now, Tashara.
Absolutely. And one last thing here on the COVID note, the new bivalent COVID vaccine has been available for a little over a month now. How is that being received?
Yeah, not very much. I was interested to find this study just the other day. If we look at folks over age 65, those are the ones that quickly went to the original vaccines, and 92% of all older folks age 65 and older have gotten the original series. Now, only 8% have gotten this new bivalent. Younger folks have even a less incident of that. Now, the older folks say they plan to get one, but they just haven't done it yet. So we've got a lot of people out there that have not been adequately vaccinated right now. We got COVID out there and COVID coming, so I'm a little nervous about this with flu, RSV, another surge with COVID. That's that triple-demic we talked about before. That's kind of scary.
We need to get those vaccines taken care of. Dr. Winter, always good to hear from you.